Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? This is a true moment straight out of House MD. It both illustrates how straight up dumb luck can determine whether we live or die and how well trained and observant some professionals are. A neurologist I was rotating with once was walking to the parking lot through the emergency department, and one of the docs stopped him and asked him to do a quick look-see on a lady he was about to discharge home. We called these drive-by consults. This woman had some vague, not specific complaints like headache and passing dizziness, but nothing out of the ordinary, and all tests in the ER came back negative, so she was waiting for discharge. Neurologist spends 5 minutes with her, comes back and says admit this woman and do a stat MRI of her brain. He noticed an extremely subtle vertical nystagmus of her eyes. A nystagmus is basically a repetitive, uncontrolled movement of your eyes which can have dozens of causes. A horizontal nystagmus is what you'll see 99.9% of the time, and it's usually benign in origin. Vertical nystagmus, on the other hand, is a stroke in your cerebellum until proven otherwise. They sent the woman to MRI, which showed infarcts in both sides of her cerebellum, and she was in neurosurgery the next morning. If it weren't for that drive-by, she would have been sent home and probably died overnight. I had to tell a 104-year-old patient that he was only the third oldest patient on the ward. He was really disappointed. The other two suspiciously died later that night. There can only be one. During my residency, I worked in a unit which did a lot of urology. We had a series of regular patients with urethral strictures, narrowing of the urinary passage, and they used to visit from time to time to get their strictures dilated. These veterans would eventually learn how to catheterize themselves. One of the patients, a young boy of 14 whose original injury had been a pelvic fracture in a road traffic accident, came to the ER on a Saturday in considerable discomfort. I was on call and asked him what happened. I passed this catheter in and I can't get it out. What he was using wasn't really a conventional urinary catheter which has a balloon at the tip to keep it in place, that can sometimes get stuck if the channel to deflate the balloon gets clogged. But that was not the problem here. He was using an infant feeding tube because the conventional catheters were too big for his narrow passage. The feeding tube is just a simple tube with no swellings and no mechanism to retain itself in the bladder, so I didn't really believe him. However, I found that he was right. I couldn't get the catheter out either. The catheter was fitting so snugly in the stricture that he couldn't pass urine, and his bladder had filled up like a balloon about to burst. We took him to the OR and did a suprapubic cystostomy, basically made an opening into the bladder from the abdomen. This relieved the pressure in the bladder. Next we passed a scope down the SPC and found that the feeding tube that he had used as a catheter had gone into the bladder and got knotted around itself. Every time we tugged on it, the knot was getting tighter. We had to cut it off below the knot to get the rest of the catheter out. We got the knot out from the SPC. I'm not a doctor but a patient. I was born with a large vascular tumor in my right thigh around my right hip that caused my right femur to gradually die. But my case wasn't 1 in a million but 1 in 7 billion. Why? Being born with a tumor is very rare, about 0.3 in a million, plus it was vascular. It was very large at approximately 18 by 11 by 15 cm, about 7.5 inches by 4.5 inches by 6 inches, and contained more than half my blood volume. Despite its size, it was not visible. There were no bulges or discoloration or visible signs. This means it was embedded and striated in my muscles, and caused many lifetimes worth of physical pain. Fast forward to when I was 21, they discovered I have osteonecrosis of my right femur. Essentially the blood supply to my femur got cut off and the bone started to die. I saw literally more than 100 doctors and no one could figure out why I have it, why at such a young age, and what they didn't understand was this never before seen comorbidity. No scientific literature on cases remotely like mine. My case was discussed by doctors worldwide and it was confirmed to be the first case in the world. In order to even begin treating the bone, I had to have my tumor removed. I was scheduled for a surgery in mid-2017, was told it was just going to be a 5-hour surgery and that I'll be free from the tumor after this. They told me with any surgery some bleeding is expected, which is frankly common sense, but that I didn't have to worry about it because they ran thorough blood tests on me and I showed no abnormalities in the blood. I woke up 4 hours later and the surgeon told me they were not able to remove the tumor. What happened was, after they cut me open and before they got anywhere close to my tumor, I started hemorrhaging and lost more than half my blood volume instantaneously. I just wouldn't clot at all and they didn't know why. Went into shock and I almost died, at the age of 21. Later I saw a hematologist to figure out what went wrong, and she told me in her 30-year career she's never seen a vascular tumor like this, and such weird bleeding. She had to order a rare blood test and it was determined that I have an extremely rare blood disorder found only in vascular tumors. Somehow the blood in my tumor spontaneously formed many clots, on a daily basis, and I ran out of clotting factors and platelets. Because of how isolated the tumor was, they couldn't detect this abnormality with blood samples of blood flowing in my bloodstream. I continued to deteriorate and there was no way to fix me. In January 2018, less than 2 weeks after my 22nd birthday, I was told I was dying and had at most only 1 year to live. I had two options: one is to be content with the time I have left and do nothing, or risk everything entirely to go for a surgery ASAP, but it has a 90% mortality rate. Normally doctors won't operate if they know the patient might die, but in my case not operating will kill me. They had to take any chances of survival no matter how slim. Got booked in for a surgery to try to remove the tumor. The nature of the surgery was the first of its kind, the first in Australia with more than 20 surgeons involved worldwide. I was in there for 12 hours and in a coma in the ICU for 5 days. 2 muscles and 70% of the tumor was removed and now I have a huge dent in my right thigh, permanent nerve damage. I don't feel a thing. Despite everything, my doctor said that it's a miracle I'm alive. There are some after effects though. I suffer from severe PTSD, depression and anxiety, on top of my severe chronic pain. I have one last surgery for now, which is a total hip replacement, a common surgery but not at the age of 23, but with extra details like removing my dead femur and dealing with my rare bleeding disorder. However, due to the complexity of the case, my bleeding issues, and that the remaining 30% of the tumor that they were unable to remove is the same part of the tumor that almost killed me, it's a tad bit different and I'll have more than 5 surgeons involved in the upcoming surgery. Wish me luck. Edit. Measurement in inches. Edit. Thank you so much for your wishes. I'll continue to fight on. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. We call them elite suppressors and they probably still benefit from being on HIV meds because it probably reduces chronic inflammation in the body. Creutzfeldt-Jakob disease without relation to mad cow, the prevalence of which is about 1 in a million persons worldwide yearly. I had a patient with that once. The neurosurgeon told me, I don't know why he was being seen by him, no surgery options, that they can't even confirm the diagnosis until autopsy, and they usually don't autopsy because they can't ever use the tools again. Prion diseases are fucking terrifying. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Lab tech here. We see worms very often. Disgusting and interesting at the same time. Once when a female patient was submitting a urine sample, a full worm worked its way into the cup. It was Ascaris lumbricoides. Gotta love the medical field. Edit. So sorry that I ruined everyone's lives, the more you know. Thanks. I hate it. Had a patient come in with headaches and she was a young woman. Her entire body would go numb with these headaches. Got a CT. She has 3 separate tumors in her brain. What happened to her? Did she live? Assuming the 3 tumors were metastases, not actually 3 independent, possibly different tumors, then odds are bad for long-term survival. I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure, and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid in him and the ED before they were barely able to get a BP on him. Worked oncology for 5 years and I've had several with no discernible BP and one with no palpable pulse. That shit will make your own BP shoot through the roof. Medical student here. Had a 13-year-old who presented to our service with a heart attack. After we worked him up, it turns out when he was a toddler he had unidentified Kawasaki's diseases that went untreated. One of the complications is coronary artery aneurysm, which in his case clotted over and caused the heart attack. Overall, he got better but has to be on blood thinners for the rest of his life. Edit. Since people seem to be confused about the timeline, he had Kawasaki's when he was a toddler and spent a week in the hospital with a fever of unknown origin which wasn't diagnosed, and he got better on his own. We saw him 10 years later when he came to our ED with a heart attack.
Thanks for watching the video. Make sure to subscribe for more videos and don't forget to leave a like.